Today we are going to describe uh, types of diabetes because in clinic few patients come and they always ask, what is, sir, what is my diabetes, what type of diabetes I am having, type 1 or type 2. So this much they know. That means the patients, they know type 1 and type 2, but they do not know exactly what is type 1, what is type 2. But whatever it may be, before going to say about the types of the diabetes, I should tell about what is diabetes. So diabetes, most of the common people, they know that there is rise in blood sugar, that is called diabetes. So there is some criteria from which it is determined by two big associations which controls the diabetes management all over the world. This is American Diabetes Association, or another one is World Health Organization. So they formulated some protocols by which we can say that after this much of blood sugar, this is called diabetes. So this is true, but thing is that it is a very complicated things again. What blood sugar, I should say diabetes. But still we are following the guidelines formulated by American Diabetes Association or World Health Organization. So what is diabetes? Diabetes is nothing but a rise in blood sugar level which creates some metabolic changes in our body. So it is rise in blood sugar level along with some metabolic changes occurring in the body itself, which creates a lot of dysfunction in our body. So whatever we are eating, we eat mainly three types of foods we are eating: carbohydrates, proteins, and your fats. So these carbohydrates, proteins, and fats, these are utilized in our body, and for this utilization we need insulin, which is secreted by beta cells of the pancreas. So pancreas, very few people know about pancreas, but everybody knows about the liver. So pancreas is as important as liver itself. Pancreas is very important organ because it secretes insulin, which will control the blood sugar in our body. So pancreas secretes insulin by beta cells, which is controlling our blood sugar. So definitely in diabetes there will be some defects in insulin. Either insulin is secreted less than required, or insulin is secreted normally but it is not acting properly in the target tissues or target organs. So depending upon this, we can say a body, whether a person is having normal sugar level or diabetic sugar level. So when there is insulin secretory defects or insulin axon defects, we may have diabetes. So that is 100% true, there is no confusion. So if some patients ask me, मेरा diabetes type 1 है या type 2 है sir, so they are conscious about the type 1 and type 2 diabetes. They want to know about that. So, but practically I am saying, for nowadays, both are actually type 1 and type 2 diabetes. Previously it was very clearly it was told that certain age, after 30 or 35, if diabetes is happening, that is called type 2 diabetes. If below that 30 years or 25 years, that we can say it is type 1 diabetes. But often it is seen that type 2 diabetes also occurring in type 1 age groups, and type 1 diabetes is also occurring in type 2 age groups. So there is a vice versa situations whereby we cannot say exactly that age criteria is, because it depends upon ethnicity, foods, quality of life, lifestyle. So this definitely will vary from country to country. So whatever it is determined, whatever it is fixed by American Diabetes Association may not be true here, may not be true in India. So somewhat some differences is always will be there. But thing is that unless and otherwise the blood sugar is giving damage to the target tissues or dysfunction to the target tissues, it cannot be diabetes. Actually, there should be some changes in the organs, some changes in the tissues or metabolic changes, which can be diagnosed, which may be very subtle in nature, which is very difficult to diagnose. But whatever it may be, basically what we say about 126, fasting 126 milligram per deciliter, that is, we say it is diabetes. Or again, random or PP 200, more than 200, we will say it is also diabetes. So besides this, we sometimes do another test that is called HbA1c, which will say about the blood sugar levels. That is fluctuating, because the blood sugar is always fluctuating day by day. It is not fixed, depending upon your food intake, depending upon insulin secretions. So it may vary. So sometimes one day blood sugar, your normal blood sugar itself will vary in a range. But anyway, if it is above 126 fasting, we say it is diabetes, so far as the diabetes treatment is concerned. So generally type 1 and type 2 diabetes, we are not very much concerned, because sometimes always overlap is there. But basically type 1 is always due to defects in insulin secretion, secretory defects by pancreas. But type 2, it is seen that there is some insulin secretion is maybe same, maybe normal, but action will be low, that it cannot act at target organs. So insulin action or insulin resistance, it is called insulin resistance. Normal amount of insulin cannot work properly. So that's all today. I will describe another topic in the next classes, next lecture. So thank you very much once again. Please subscribe it if you like it. Okay, thank you.